Welcome back to Making Connections, Exploring Trauma and Attachment. Today we have Karen Doyle Buckwalter here with us, and she's the Director of Program Strategy at Chaddock. And my name is Karol Ehmen, and I'm your host for today. So Karen, thanks again for joining with us again.
Yes.
We really appreciate that. And today we're going to talk about a new program that you have at Chaddock that's called an intensive program. And so can you explain the intensive program to us?
Absolutely. The name sort of gives it away. It is an intensive way of working with families, meaning that most of the time when families go to therapy for their child, for a child with attachment difficulties or a history of trauma, in terms of what we're talking about here, is they'll go weekly. They'll have weekly therapy sessions with a therapist. And sometimes the severity of the child's difficulties just is not responding to that. When you think about that, maybe 50 minutes to an hour of therapy in 1 week, that's a small amount of time when you look at the whole course of, 7 24-hour days. And so what happens a lot in those situations is then families really begin to struggle, and sometimes the children end up being in psychiatric hospitalizations because they're going to a therapist, but the child's still really acting out or having a lot of problems in the home. Parents may be getting called from the schools a lot, at their workplace, and just really, what they're trying to do does not seem to be ameliorating or lessening the behaviors that the child is having.
It's just basically continuing that unhealthy cycle.
Exactly. And so oftentimes at that point, we get a call to Chaddock from a family thinking maybe we need residential treatment for our child because we're trying the services that are available in our community on an outpatient basis, and maybe we need some kind of longer term placement at a place like Chaddock. And what I have found over the years in talking with those families is that there could be a chance that maybe seeing the child several hours for consecutive days and also using a lot of the specific attachment and trauma models that we're familiar with that many times maybe the therapists are seeing in their home community isn't familiar with. If we could combine the intensity with the right tools, we could perhaps prevent a residential placement. Going for an hour a week of therapy to the child living somewhere else, that's a very big step.
Right.
So we're looking for an in-between step. Usually when a child is in the local hospital, that's really more a quick, short-term trying to stabilize the child and get the child back home.
Okay.
It's not really designed to do this kind of intensive treatment that we're talking about that we would be doing in the intensive program.
Okay. It sounds like a lot of hard work.
Mm-hmm.
And it sounds like it might go over a longer period of time than typically we've seen. So does the family actually come to Chaddock then, or do you actually go to them? How does that work?
Well, if the family lives in the state of Illinois, then we would very much prefer going to their home, and there's a lot of advantages to doing that. One is convenience for the family, of course. It can be disruptive to have to come to somewhere like Chaddock for maybe up to a week, because our intensive goes as long as a week, and we work with families anywhere from 1 day to up to 5 days. And those are all day sessions, probably about 6 hours, maybe even longer than that, actually coming back and being with the parents during the evening as well. So there's the convenience issue. The second thing is the advantage of going into the homes is that we can really be part of that whole family dynamic and really get a better sense of what's going on and do a lot of coaching of parents right in the moment. So when their child is struggling or maybe having a meltdown over their homework or about going to bed or something, because we're right there while it's happening, we can be available to educate, support, and coach. Whereas a lot of times when you're going to therapy on an outpatient basis, you're certainly learning things in therapy, and you might be learning different parenting approaches being talked about, but it's just not the same to actually be in the situation and try to figure out, okay, what did I learn there that applies here? And that can be difficult for parents in the heat of the moment. And so being in the home allows us to actually be right there while the the situation is happening. Parents who are from out of state, at this time, those folks would be coming to Chaddock and actually staying in the area for a period of time. And what they would typically do is stay at a hotel here and work with us during the day, go back to the hotel at night, come back the next day, for however many days it's been determined that the intensive would be most beneficial for their particular case.
So you really are talking about, it could be a multiple day scenario.
Yes, it could be.
So how does that work? How do you decide if you need a 1-day session or a 5-day session?
Right. We have an application packet that we have families fill out that gathers a lot of the history of the child, things that the family has tried, if there have been psychiatric hospitalizations. Usually these children, when their challenges are this significant, the family's already working maybe with a psychiatrist or a therapist in their community. So we would also want to talk with them, get their thoughts and their ideas. So we very much are taking a team approach in this initial information gathering stage. And once we do all that, we talk to the family about the different options that we would have and what we would recommend, whether we would recommend 2 days or 5 days or 3 days. And some of that's going to be based on their schedule and what they feel like they can manage as well.
Do you feel that sometimes maybe someone starts out with a 1 or 2 day and they then expand it to be a 4 or 5 day along the way?
Yeah, absolutely. Or that's a good opportunity for families to get to know us a little bit and be exposed to some of the treatment approaches that we use. They may be different than things that the family has done before, and just kind of see, before they invest themselves fully in maybe 5 days and all the planning and resources that takes, they could sort of try out, like you're saying, a couple days to see do they click with us? Does what we're doing seem to make sense, and does it seem like it's going to be helpful?
That's also good information. Now you keep saying we, so I know that you're a major part of the team that is part of the intensive. Now who else do you have with you?
The other person is Marcia Ryan, and so as we work together with families, my role is the therapist and doing a lot of the therapies, and Marcia is her role is the parent coach and doing a lot of the hands-on actual behavior management ideas with the children. Marcia has worked in the Chaddock residential cottages for over 20 years, so she's very good at managing in the moment day-to-day behaviors with the children. Whereas a therapists most often are, as we talked about before, seeing maybe just the parent and the child together for a set amount of time, and not necessarily as comfortable perhaps being in a home and doing that kind of hands-on coaching kind of thing. So we find the combination of my experience and Marcia's experience together seems to make a very impactful intervention with the families.
It seems like the perfect package because you have two very different specialties that you can bring together that are both really needed for the parents and for the families.
Exactly.
So that sounds like a great approach.
Yeah.
How would someone find out some more information about the Chaddock Intensives?
The best way is to call me directly here at Chaddock. That number is 217-222-0034. And my extension is 319. And usually the call will start out maybe just a 20-30 minute discussion with the parent. What is this? Can you tell me a little bit about it? Tell me the different treatment models you use, because we use a lot of different approaches, and really just getting a feel for the parent and if this might even be something that could be helpful and we should try to pursue further. And then at that point, if we decide that is the case, that we'd like to pursue this further, that's when I send them the application packet.
Okay, great. Now, what has the response been from parents that have actually gone through this process with their children?
I think that the parents have found it very helpful. I think that, as I said, that level of intensity, being with a family several hours a day, a lot of patterns emerge that the families, I think, are often unaware of that are really happening, because they're so caught up in some of these difficult negative cycles with their children and under so much stress, that even if they're going to a therapist, it's not that they're trying to hide the information or they're not trying to be totally open and honest. They're so worn out and they're so tired and sometimes even traumatized themselves as a result of what's going on with the child that they may not be reporting some of those things. Whereas in the intensive, we're right there and we can help with that.
I know this from being a parent myself. Sometimes when you're in the moment,
Exactly.
it's hard to take a step back and really look at the situation and see what the best opportunity is presenting at that time.
Yes.
Yeah, so that sounds like a great opportunity to have, for other eyes watching what's going on and offering feedback and helping repair that family units.
And so I think families have appreciated that. And then also I think the other thing is the team that's already working with the family, whether that be teachers from school, whether it be a therapist, a psychiatrist, I think they have really appreciated the feedback and the information that we can share, because none of them, also by virtue of their roles, are able to spend this much concentrated time with the family. So we're able to take the great information they've given us and the good work they've likely done with the family and add that to all of our observations and suggestions to leave them with, I think, some good and new ideas to try with the family and to continue with the family.
Now when you go home, you go back to Chaddock, then do you have any more contact with that family? What's the follow-up like?
Yes. That's a good question. The intensives, the different levels are set up kind of in a package of what each includes, and they do include follow-up phone calls with the family. And so we schedule those phone calls sometimes weekly, sometimes every other week. It just really depends what the family feels like they are going to need. And some families, even after we've done maybe the 4 phone calls, they'll say, oh, how about if we have a few more, before we quite, separate. And it's always important to remember that we want their home community support system to be built up and stay connected with them too. So it's not like we're just then leaving their life and they're not having any kind of connection with anyone. So that's why we want to be working with those home providers as well.
Great, but what a wonderful comfort for those parents is to know that you're going to have those phone calls so you can check in and make sure that you're doing everything the way you should be doing.
Yes.
Everything's going as you'd hope. So that's wonderful.
Yeah.
Well, Karen, thank you so much. It's so nice. We've run out of time. It's nice to know about the intensive and to hopefully offer that information out there for parents who might be looking for something like this program.
Absolutely.
So again, to contact Chaddock, it is how?
Just call, ask for Karen Doyle Buckwalter, and the number is 217-222-0034. My extension is 319.
Very good. Thanks again, Karen.
Thank you.
Thank you for joining us for Making